Welcome back. Let us now deal with the 4 aims of increasing female age. There's no doubt that increasing female age is associated with a decrease in normal fertility and an increase in infertility. But this is not the whole story. We have a problem of multiple minor factor infertility. If we look at the chart below, we can see in young women under the age of 30, if 2 infertility factors occur together, this will reduce a 2-year fertility from 93% to 25%. One of these factors is often age, and all too often I'm faced by patients who say, what is the cause? Is there another problem? And they will continuously negate the importance of female age. So let's just look at the age factor and chances of conception. And if you look on the left-hand side of the graph, you'll notice that a 22-year-old female has a 25% chance of achieving a pregnancy on any one cycle that they try. This is unlike large animals, which would have an 80% chance. And therefore, the starting point for normal human fertility is quite low. I've highlighted this a little further when we look at the fertility at age 25, which would already be about 22% per month, at 30, where it's approximately 17%, at 35, where it's down to about 12%, at 40, where it's now 4% per month, and at 45, it's approaching 0. In this rather complicated graph, what we're discussing is the effects of age on ovarian reserve. And from the graph, you will notice that women, during the course of their development inside their mother's uterus, in other words, before they were born, have a maximum of about 4 million eggs. And by the time they're born, they've already lost half their egg supply. They continue to lose these eggs all the time until the last eggs are used up at menopause. This is not ovulation. This egg loss occurs before puberty, after puberty, whether you're on the oral contraceptive pill, whether you're pregnant, or whether you're breastfeeding. Another name for this loss is apoptosis. Your egg supply, otherwise known as the ovarian reserve, can be measured. And tests of ovarian reserve are an antral follicle count, which is achieved with ultrasound, or anti-Mullerian hormone, which is a blood test. The most important take-home message from this is that even though you do have eggs, this test is not a test of egg quality. We also notice now that, of course, as we've been discussing, fertility decreases with age. You'll note from the graph that the optimum age for fertility is from the age of approximately 18 to about 32. Fertility then starts to decline till the age of 42, and if one has not had a child by the age of 42, the chances on average of a woman having a live child after this are very slim. Another problem of age, of course, is miscarriage, and this is one of the reasons why I stress the importance of having a live child as being a sign of fertility. Because older women do fall pregnant, but their rates of miscarriage, as can be seen from this graph, dramatically increase. So that over the age of 45, even if you do achieve a pregnancy, your chances of miscarriage are well over 90%. I've tried to demonstrate how, with increasing age, not only does your egg supply diminish, but that the quality eggs, or the number of quality eggs, rapidly decreases. Finally, increasing age has another important effect. It's one that's not normally discussed, and this is on the size of a family. And if we look at this little chart which shows size of family versus starting age, you'll notice that for a 90% chance of success, to have one child, you need to begin by the age of 32. To have 2 children, you need to begin by the age of 27. And to have 3 children, you need to begin by the age of 23. And remember that the average female is having her first child at age 32. If we look at a 50% chance of success, then to have one child, the latest you should be starting is 41, for 2 children 38, and for 3 children 35. And therefore, I'm sure you've realized how significant age is. Join me for the next part of this mini series.